Welcome to the webinar. Today we'll be discussing considerations for planning early childhood environments during the COVID-19 health emergency. We'll be focusing on preschool classrooms, but some of the information may be applicable to other early childhood grades. I'm Andrea Brunell, 619 Part B Manager and Early Childhood Specialist at the Connecticut State Department of Education.
Hi, I'm Michelle Levy from the Connecticut Office of Early Childhood. I'm the Program Manager for Smart Start and work on many quality improvement efforts.
The need for young children to interact with adults and their peers and to engage with their environment hasn't changed, but our circumstances have. As a result, we need to make every effort to mitigate the risks to health and safety related to COVID-19 as we consider the classroom environments for our youngest learners. It'll take planning, but we can mitigate risks and address children's developmental needs at the same time. Classrooms will need to look different, but early childhood classrooms can still be a fun and engaging environment for our youngest learners.
Let's briefly review current guidance. We won't review the specifics of the guidance here, but we will mention the various areas that might impact your classroom environment. You'll need to consider and reference the Connecticut State Department of Education's Adapt, Advance, Achieve document and addendums, as well as other CSDE guidance. You'll also want to reference the Connecticut Office of Early Childhood's memos and guides for details about the specific requirements. There is specific guidance that's been issued related to the following areas: enhanced cleaning, which involves cleaning of shared spaces, materials, and different surfaces. Cohorting, social distancing, and mask wearing are also addressed in both CSDE and OEC guidance. Health screenings are required, and finally, hand washing and hygiene practices are an important strategy that must be implemented. It is important that programs implement multiple mitigation strategies to support health and safety in a developmentally appropriate manner. Schools and programs will make decisions about how these strategies overlap and how one strategy might be enhanced at times when other strategies might not be as realistic. For example, social distancing and mask wearing are two strategies that are very important. When distancing is at a maximum and children and staff are outdoors, as a mitigation strategy is no longer required.
Remember that the basic tenets of early childhood education haven't changed. Research has shown that young children learn through play and social interactions. As we set up our environments to address health and safety and implement guidance related to COVID-19, it's also important that we consider how we're setting up the environment to allow for intentional play and to build relationships, both between peers and between children and adults. First, we're going to discuss preschool classrooms and how they can be set up to include important mitigation strategies while still addressing the developmental needs of young children.
Consider how spaces are arranged to continue to provide a variety of experiences for young children, including whole group, small group, and individual time. You'll also want to consider how children build relationships and when they're able to experience individual supportive interactions with adults. Here are some examples of whole group arrangements. Remember, whole group time should still be limited for young children. Children should have opportunities to engage in individual activities in the classroom, although this should not be the only type of activity that they are able to engage in. Consider what types of spaces allow for children to engage in solitary or quiet play for periods of time. Small group experiences are a key strategy for supporting learning for young children. It's important to consider how children can safely share experiences and interact in small groups. The use of masks, spacing, hand washing, and sanitizing of materials can be strategies that might be implemented or enhanced in order to allow for these small group experiences. During COVID-19, there might be an inclination to focus more on whole group and individual experiences in an effort to maintain physical distance. But by implementing wearing of face masks, hand washing, and sanitizing procedures, you can safely ensure that children still get valuable small group experiences. Social or physical distancing is a key mitigation strategy that's used in combination with other strategies. While physical distance should be maximized when possible, current guidance does not require that all children remain 6 feet from other children or be separated by physical barriers at all times. As you think about spacing and barriers, there are a few important considerations, including whether children are in a consistent cohort, whether they are wearing masks, how many children are interacting, as well as the nature of the activity. It is also important to consider the experiences and intended learning for children. For example, providing sensory materials in separate bins and spacing them apart might provide a rich experience with the physical distancing. In the block area, allowing children to work together to build a structure might be an important experience. In this case, you might limit group size to encourage distance, but allow 2 or 3 children to share space as they work on the structure. You can also incorporate sanitizing of materials after children have used them. Remember, current guidance does not require all children within the same cohort or group remain 6 feet apart from other children or be separated by physical barriers at all times. The images on this slide were taken at a public school early childhood center this September and represent efforts to provide choices for children and still allow for staff to monitor the materials. In the second example, hand washing might be incorporated before and after the increased physicality and sharing of materials.
Professionals entering the room. There may be occasions when additional adults must enter the room. For instance, special education teachers, therapists, or special area teachers. Consider setting aside a location in the room if the adult is there to provide instruction for specific students. The area should be cleaned and sanitized before and after its use. You should have cleaning supplies available for this purpose and written procedures in place. If the adult is there for the whole group instruction, he or she should be distanced from other children and other adults during instruction. Allowing for a variety of experiences. The CDC recommends that early childhood programs routinely clean, sanitize, and disinfect surfaces and objects that are frequently touched, especially toys and games. Toys and games may be used by multiple children in a cohort. Since these are considered high-touch surfaces, a plan for routine cleaning and sanitization should be developed. Programs are not required to remove all games and toys from a classroom. Consider strategies that might make the cleaning and sanitizing process manageable, such as limiting the number of items available at one time or having a designated time and process for disinfecting toys that have been shared. Programs may also consider incorporating hand washing before and after sharing toys. Remember, if a child puts a toy in his or her mouth, it should be removed from the classroom materials and put aside until it can be cleaned and sanitized. Children should be able to independently access a variety of materials. Toys that cannot be cleaned and sanitized shouldn't be used. Children should be allowed to have choices. When planning for the environment, including the materials that are available, consider the variety of experiences children need to support their development. Centers such as dramatic play, blocks, table toys, books and puzzles, and art may be offered as choices, but could look different as you layer mitigating strategies into your planning. The number of children playing with specific materials or in individual learning centers may be limited to promote social distancing. For instance, only 2 children in the block area at a time. This will allow for opportunities for sharing and cooperative play. A program may choose to limit how many centers are in the room and can be visited each day, and encourage extended time in the centers that are chosen. This can be an opportunity to scaffold children's learning through the encouragement of deep, extended, imaginative play, which we know is so very important. Consider what toys are made available. For instance, play food and dishes are likely to be placed in or near a child's mouth and should be used only by one child and not shared. Dress-up clothes that are able to be laundered may be shared within the same group of children. The CDC has noted that books and other paper materials are not considered a high risk and don't require additional cleaning and disinfection. As you design your classroom environment, consider how strategies can be layered. Think about how cohorting, small group size, and frequent hand washing are part of your plan. On this slide, you see an actual classroom in an early childhood center that was taken this September. What do you notice? There are centers and a variety of materials available. As I said before, the number of children playing with specific materials or in an individual learning center may be limited to promote social distancing. For instance, only 2 children in the block area at a time to allow for opportunities for sharing and cooperative play. Think about how you can layer mitigation strategies. The images you are seeing are from actual classrooms that have opened during the COVID-19 health emergency. What do you notice? You may have noticed that there are a variety of materials that are available to children. You don't need to remove everything from your classroom, which includes carpeting. It's important that programs implement multiple strategies to support healthy and safe development and safety in an appropriate manner. It's important that programs implement multiple strategies to allow for opportunities for children to interact safely. Children in preschool should be able to access sensory play materials like Play-Doh, sand, and water. Sensory materials that aren't able to be cleaned and sanitized like other games and toys. As a result, children should wash hands prior to sensory play and after sensory play. No different than the National Association of Young Children's program standards during typical times. Think about how materials can be made available in separate containers spaced apart to allow for interactions between children while they use individual materials. Consider how adults will encourage language and other modes of communication as a way to promote children's abilities to share ideas and thoughts since they're not sharing the actual materials. What do you notice in these photos? What's practical? When planning the environment, you can also plan for some materials to be set aside for individual children. Art supplies like crayons, markers, scissors, and glue sticks can be placed in individual Ziploc bags or containers and labeled with the child's name and picture to allow for independent access as appropriate, and adults will be able to monitor the use. These individual materials will not be required to be cleaned and sanitized like high-touch surfaces used by multiple children. There are some materials that just aren't practical for use by only one child, such as unit blocks. Multiple children in a group can use unit blocks, and as a high-touch material, they should be routinely sanitized.
Visual reminders and cues are an important part of conveying expectations, supporting children to be successful, and minimizing challenges. Consider how physical cues can help children to remain distant, follow routines, and allow for choice. We know that you all have very carefully set up your classrooms to promote distancing and implement other health and safety measures. We're sharing many strategies you've probably already considered or implemented. Our lens today is around strategically implementing these various strategies so that we can support ongoing play, interactions, and well-being. In this classroom, they implement a question each day that the teacher supports every child to answer. They make sure that they can verify the responses to this daily question. This process came out of a project related to supporting executive function skills. In this classroom, they've changed the process and used the Lego board so that it can be easily cleaned. This particular question provided a visual display about masks and led to a discussion of why we wear masks. They observed how everyone was wearing a mask and how you take care of your mask. They even added a mask to the classroom puppets. It's unrealistic for young children to maintain social distance from each other during all play activities. Young children need to have access to a variety of materials, and they need to interact with children and adults. Young children are learning and need to practice things like cooperative play and sharing. Children should be allowed to interact with other children. However, enhanced cleaning practices, provision of adequate materials is necessary. Surfaces and objects that are frequently touched, especially toys and games, are part of a routine cleaning, sanitizing, and disinfection. One of the most important strategies is that of cohorting, keeping groups of children together. That, layered with mask wearing and other strategies, allow young children the opportunities for the much needed play that will help them to learn.
We want to give a special thank you to Julie Giacconi at CREC and Jacqueline Valley from Enfield Public Schools Stowe Early Learning Center for providing us with photographs for this presentation. Thank you all for watching. Thank you for taking the time to view this webinar. We hope that the information and considerations it contained helped you to effectively plan learning environments for young children during the COVID-19 health emergency. You're welcome to contact either myself or Michelle if you have additional questions.
Thank you.